Good morning. Lovely to see so many of you here. If I too can just take a moment to acknowledge the traditional owners of the lands on which we meet, the Ngunnawal people, and pay my respects to elders past, present, emerging, and of course acknowledge any Aboriginal and Torres Strait Islander people here with us today. So I've got a little talk, but what I would like to do, with your indulgence, is do a little bit of my talk, but I want to hear from you too, and I'll explain to some extent why it's so important that I can hear and connect with you and hear your voices. It's my privilege, definitely, to be here this morning, and it's a great opportunity, and that light is so bright. Whoa. But it's St. Patrick's Day. Now, I couldn't find anything green in my wardrobe. Oh, well. But it's St. Patrick's Day today, so I don't know if you know about St. Patrick, but I looked him up. He is, of course, the patron saint of Ireland. He was born in Roman Britain in the late part of the 4th century. He was kidnapped at 16 and taken to Ireland as a slave. He escaped but then returned to Ireland to convert Ireland to Christianity. And by the time of his death in 461, a little while ago, he established monasteries, churches, schools, and many legends grew about St. Patrick, including that he drove snakes out of Ireland, which would have been a little bit of a challenge because there were no snakes in Ireland. But it's St. Patrick's Day, so for those of you, like I, with some Irish ancestry, it's a day to celebrate. I will be avoiding green beer, I must admit, and probably most Irish pubs today. Can I acknowledge, of course, the incredible contribution that you as nurses and our colleagues as midwives make each and every day to our community. I think we are at a really important part of the maturity of the nursing profession in Australia. There is a point now where I think we will look in the future and look back and say, the circumstances that bring us to this point make and create enormous opportunities for us to further develop our profession, but also to contribute increasingly to the health and well-being of our community. Times are difficult, we all know. Socioeconomic pressures are enormous. The cost of living is impacting almost every one of us, I think, across the country. The geopolitical situation and the instability, hearing ABC News this morning talking about never has it been more unstable since before the Second World War. There are threats on the horizon that we need to be cognizant of, and that does make it challenging. Given the fact that the pandemic now no longer in its emergency phase, but not by any means gone, we are in challenging times, and I think it will test our mettle as Australians to see how we get through this. So that's why I think nurses as we are, as generalists, and I think in my mind, and I'm happy to be challenged on this, and that's why I want to hear from you, we are fundamental generalists. We provide care across the entire continuum of the health and aged care system, and we as nurses have the greatest contact and impact on patients' lives and their care. We are in every element of healthcare, wherever it is, whether it's in a metropolitan tertiary centre or whether it's in a remote Aboriginal community. And we should be proud of that and celebrate that. And as Christine mentioned, of course, the policy context in healthcare has been, in my mind, probably over-influenced by medicine, by the medical profession, and we need to bring that balance back. And as I say, there's enormous opportunity to do that at the moment. So one of the things that's really high on my priorities at the moment, as Kylie said, for the first 3 years of my appointment, I was unable to do much that I'd wanted to be able to do. I had to turn my attention at the requirement of my organisation and government to look predominantly and work mostly with the Chief Medical Officer in our COVID response. But that time and that emergency has passed, and so now I can concentrate on the things I wanted to do when I was first appointed. So one of the priorities for me, unfortunately, one of the major priorities for government, of this government, which you will have heard through the Strengthening Medicare Task Force report recently, is ensuring that all health professionals can work to their full scope of practice, but particularly, obviously, nurses and midwives are my focus. There's a really strong emphasis from Minister Butler and Assistant Minister Carney, particularly in looking at multidisciplinary teams and everyone, as I say, working to their full scope of practice. Removing those traditional barriers that we know have been there that have prevented us from doing that. One of the priorities last week that the Chief Nursing and Midwifery Officers from all of the jurisdictions talked about is nurse prescribing. And we are now resolute that we are going to drive that reform as fast and as appropriately as we can, but we as a country are well behind many other countries in our ability for nurses to prescribe. We're well trained, we have the capacity, and it will be a very important part of any reform. So the title of the summit today was Power, Persistence and Influence. The power of nurses is unquestionable, but we need to harness that power. And Kylie and Christine have spoken this morning already about the range of papers and white papers, response to consultations and all those things. And we all see that those come from the college all the time. That is your way to a voice. And those consultations and your voice through the ACN are taken very seriously. So please do take the time, put your hand up if the ACN is looking for someone to be on a committee or a consultation or whatever it is. Or if there are things to which we're sent to consult, please, it does make a difference. People do listen to what you have to say, but you have to take just sometimes a few minutes, sometimes more, to provide that input so that then I can use that as your voice, Kylie can use that as your voice, as can Christine, to amplify the message. Persistence. Well, as a profession, we've been persistent for a long time, and we need to keep up that persistence. I would suggest as predominantly a female-dominated profession, but obviously very respectful to our male colleagues. As women, we often need to be very persistent to bring about change, and so we need to keep that persistence up and not lose that the momentum I think that we have today. And influence. We can influence and we will influence. And in the modern era where authentic leadership is the current terminology, the ability to influence is more important than ever today in bringing about change. And therefore, I would suggest that the way that as a profession we can move forward is that we need to know and understand the complexity that Christine talked about this morning. How is healthcare funded? What is the complexities of governance that we work in? Because only when we have that knowledge will we be able to find the levers we need to influence the decision makers in order to bring about change. So influence is a skill that you need to work on and learn, particularly in this era today. So quickly, I'll just mention a couple of reforms that I think are as a consequence of some of the work that's been done through the college and others in recent years. The aged care changes, the Aged Care Royal Commission, we are now reaching the point of seeing some of those very important reforms. There was a very strong nursing voice that said we need to have good nursing leadership in residential aged care. It is pivotal to the quality of care delivered in those facilities. And so, shortly, there will be the requirement for 24/7, 7 days a week, nurses, registered nurses in residential aged care. And that is a consequence of the messages given to the Royal Commission by many during the consultation. Care minutes being measured and increased. All of these things will be really important, but one of the things we're going to need to do in order to achieve that is actually grow our workforce. And so we already know we have significant shortfalls across the country, but we need to work together to grow our workforce into the future. Strengthening Medicare Task Force, I've mentioned already. There will be much that I'm very excited that will be announced coming in the budget that we will see. And so that's an important area. And if I can give you my experience of looking at that, what you will have heard Minister Butler say is simply doing more of the same will not change the outcomes we have in primary care. And so through that task force and through work that the team from the department on the table there are working incredibly hard to achieve, is to see a much bigger opportunity for nurses in primary health in the coming years. And that's something we're really looking forward to and will celebrate when those announcements are made. Again, the team who are here, so come and talk to them, give them a hard time if you need to. Most of you know Karen Cooks, that's the table where Karen's sitting. Also, we've commenced the development of the National Nursing Workforce Strategy. Been a long time in gestation, but it's underway. And the SEN is a very important part of that consultation process. There will be lots of opportunities for you to contribute to that. So please do. We use multiple avenues and pathways to consult. There'll be meetings, yarning circles, consultation documents online. The college is an important part of the a strategic reference group that will provide advice to government. This is a national nursing workforce strategy, not Commonwealth. Every state and territory will contribute. All of my colleagues of chief nursing and midwifery officers are part of that process. Having a national strategy is where we will get the emphasis and momentum we need to bring about change. So Commonwealth and Victoria led in collaboration with all jurisdictions, and that's been signed off by health ministers to ensure it has that high-level endorsement by all governments. So the opportunity, as I said, is here for us now, more perhaps than it has been in a very long time. But in that, we need to make sure that our voice is heard through the college, through the consultations, through all of the ways that we can do that. And it will rely on all of you to do that, to bring that voice forward. Thank you for the opportunity to talk to you this morning, and I hope I can get to talk to some of you during the day. Thank you.